We did our project on computerized provider order entry.
Alright, so overview by Marade File. CPOE, or Computerized Provider Order Entry, is any system where healthcare providers directly enter any orders for their patients into a computer system, which then sends the order directly where it needs to go. For example, a medication order would go to the pharmacy, but a blood test order would go to the blood bank. These systems are on the rise in inpatient settings since they've reduced medication errors. These systems are paired most often with a Clinical Decision Support System, or CDSS. These systems help with reducing errors related to the 6 rights of medication administration. They have more intricate features that double-check almost everything for you. An example, warning a physician before ordering a medication that is not beneficial for the patient due to another medication. It helps to prevent allergic reactions to medications as well by screening the patient the moment the physician orders a medication. Another great tool that CPOE and CDSS uses is asking the physician when and how often he wants labs drawn with certain medications.
Some features of COPE by Nina Anderson Napier. Orders can be individualized for each physician or by specialty by using order sets. Sending orders to all departments and involved caregivers improves response time and avoids scheduling problems and conflicts with existing orders. Some patient safety, it allows real-time patient identification, recommendations of drug dosages, adverse reactions of drugs being ordered, and checks on allergies and test or treatment conflicts with the prescribed drug or drugs. An electronic signature is required for access, in which a permanent record is created. Portability, the system can be accessed from a physician's office, hospital, or home through a variety of devices, PCs, or tablets and computers. Billing, by linking the diagnosis at the time of the order entry, documentation is improved. And patient-centered decision support, it includes a display of the patient's medical history and current results, such as labs, exams, and scans, and evidence clinical guidelines to support treatment decisions.
Benefits by Sarah Haynes. The system prevents problems associated with handwriting, similar drug names, drug interactions, and specific errors. CPOE appears to be quite effective in preventing prescribing errors. This system generally paired with some type of clinical decision support system. A typical system suggests values for the drug dosages, routes of administration, and how frequent you should give them. It also offers drug safety features such as checking drug allergies, drug-to-drug interactions, or drug laboratory interactions. It is integrated with electronic medical records, decision support systems, and adverse drug event reporting systems. It also offers a faster transmission to the pharmacy and a potential economic savings. Benefits have been confirmed to have some extent, and recent studies have shown evidence-based supporting CPOE. The meta-analysis found in the likelihood of prescribing error was reduced by 48% when using this, compared to paper-based orders, which translated into more than 17 million medication errors prevented yearly in the United States.
Risks by Kelsey Gray. Staff inexperience leads to slower order entry, more staff time used, and is slower than person-to-person communication. Communication between provider and nurse worsens. Staff becomes frustrated with new technology. False sense of security leading to overdependence on technology. New types of errors and unexpected changes in institutions' structure. This technology is not being used in all healthcare facilities because of the cost. An estimated $1.9 million are used to develop and implement this technology, and a $500,000 maintenance cost.
Okay, now we're going to show a short video just going over the benefits and everything of CPOE.
Clinicians face increasing demands on their time, pressure to improve patient safety, and enhance the coordination of care. Computerized provider order entry, or CPOE, offers answers to these complex problems. Cerner's industry-certified CPOE system is more than a way to replace paper orders. In the words of Dr. Christopher DeFlitch of the Penn State Hershey Medical Center, the true benefit of order entry is its integrated care approach where nurses, physicians, and pharmacists all see and share the same information. Organizations that get the most out of CPOE create comprehensive, evidence-based order sets.
Anytime a person comes in with cardiac chest pain, I have a template of X number of orders that I can order very quickly to get them a chest x-ray, an EKG, laboratory studies, aspirin, nitroglycerin, beta blockers, all that stuff with just a few clicks of the mouse. Whereas before, for me to write that, it would have taken probably about 30 seconds. But electronically now I can do it in about 10 seconds.
Many physicians feel CPOE gives them more control over their orders.
We've gotten a lot of positive feedback from providers that have been really anxious to want to enter their own orders into the system because I think it gives them more of a feeling of control over what they're doing. They don't have to wait for someone else to do it. They know that they're getting what they want for their patient.
There was a real aha for some of our physicians when they were rounding one morning, and on one of their early patients requested that the x-ray be performed, wrote that order. Before they finished rounds, they were surprised to see the transport folks up to take that patient to x-ray. That's something that in a paper-based world would have taken an hour or more, and it was happening real time. And that helped people understand the value of automation.
Finally, and perhaps most importantly, healthcare organizations use CPOE to improve patient safety. Children's Hospital Los Angeles' CPOE system has helped providers reduce overall medication errors by 23%, harmful medication errors by 42%, and pharmacy transcription errors by 98.3%.
It's not about the software, it's about the baby in the bed. Because ultimately, our focus and goal has always been and continues to be the care for our patient.
Need more proof? Consider the praise Cerner has received from CLASS, an independent organization that ranks CPOE systems. According to CLASS, Cerner leads the field with the most inpatient hospitals live on CPOE. Cerner has more hospitals with deep physician use than any other supplier, and Cerner has the most inpatient healthcare organizations live on CPOE. Just think. In the time it's taken to watch this video, Cerner clients have used CPOE to enter 100,000 orders. Learn how CPOE can improve efficiency, safety, and care within your organization. For more information, please contact your Cerner representative. Call 866.
Okay, and then we just have our citations where we found all our sources. And that's our presentation on computerized provider order entry.